So let's now take a closer look at the status of our frontline workers in the middle of COVID-19. Joining us in the studio is Dr. Kayode Adebayo. He's the former chairman, NMA Lagos, and consultant, Lagos State Health Service Commission. Welcome to the program. So, Nigeria, we're hearing over 133 health workers have been infected by the virus. You said that the numbers are increasing. But tell us, how do things look on the front line as an officer yourself?
Well, thanks so much. The front line event is terrible. You see, let me just give you a scenario. You imagine somebody putting on PPE for 6 to 8 hours. If you ever see them removing the PPE, you will pity them. The first clothes underneath will be soaked with sweat. And for that period of 6 to 8 hours, no drinking or eating or anything. And some of them, by the time they remove the PPE, they'll be sweating and open their mouth to take breath and all that. But then, it's our calling. There's nothing we can do. It's just like a soldier, when there's a war, they go to the war front. So for now, the war all over the world is taking place in our various hospitals. And we healthcare workers are in the front line, laying down our life. A lot have died. At least I've lost about 2 friends now, medical doctors, and some are still in critical conditions. The rate of infection is very high. No matter how careful you are, before you know it could get infected. So it's so bad, but we just have to face it. The unfortunate thing is that I just hope that after this pandemic, the healthcare system in sub-Saharan Africa will not collapse totally. You know, before this, the Europe and America have been mopping up all our doctors and nurses and all that. And during this crisis, of course, COVID-19 exposed every healthcare system in the whole world, not just in Nigeria alone, even in America. You know, it got to a stage in America, they had to be graduating their final year students to become doctors. They did that too in Italy. Now, if they could get to that critical stage, you know how many people have been affected in America too? So at the end of this incident, I am sure Europe and America might mop up most of our healthcare workers. So we need to really look inward and really prepare for that crisis.
And this is hoping our numbers don't get to their numbers.
Well, just hoping our number don't get to their number, because if you look at it, fine, whatever may be helping us, the rate of spread, we might look at it as not as high as being projected, because by projection, I think around 23rd, 24th of April, we are supposed to have about 65,000 infections, but we don't have that. Whatever it is, but when you look at it critically, in the last 2 weeks, we've been having 200 to 300 every day. In another 100 days, what do we have? As at 2-3 weeks ago, all our isolation centers are filled up. Now, the Center for Disease Control said people will be those that are positive will be managed from home. When you look at the Center for Disease Control website, their report there, even as at this morning, their report there is, out of the 200 plus that have died, 50% of them died because of self-medications at home. If you check their website now, you will see it there. Now, that means if everybody have been reporting early, maybe by now we just have about 100,000, about 100 deaths plus. Now we have 200 plus. So if they now change to this idea of managing patients in their homes, that means we should be expecting increase in death rate. That means we should be expecting increase of infection across those households.
But I'm sure they will be supervised.
How many homes do you want to supervise? We're talking of a country of over 200 million. Lagos of between 20 to 25 million. We should look at the capacity we have and the manpower before we project into things that could be very dangerous.
All right. Dr. Kayode Adebayo, always a pleasure. Thank you so much. Former Chairman, NMA Lagos, Consultant, Lagos State Health Service Commission. Thank you for joining us, and all the best as you fight on the front line.
Thank you.
European countries are considering easing coronavirus-related border controls. This is coming as WHO is warning of a second peak of cases during the first wave of the pandemic if lockdown restrictions are lifted too soon. Dr. Mike Ryan, the WHO's head of emergency, says that the disease is still on the way up, and so countries need to be aware that it can jump up at any time. In the meantime, over 5.5 million cases have now been recorded worldwide. Sadly, more than 340,000 have died, but about 2.2 million people have recovered.
The World Health Organization is warning of a second wave of COVID-19 infections if lockdown restrictions are lifted too soon. Dr. Mike Ryan says countries where cases are declining should be using this time to develop effective trace and test regimes to ensure a downwards trajectory so as to avoid an immediate second peak.
I think right now, countries in Europe, countries in North America, many other countries around the world in Southeast Asia have to continue to put in place the public health and social measures, the surveillance measures, the public health measures, the testing measures, and a comprehensive strategy to ensure that we continue on a downward trajectory and that we don't have an immediate second peak.
In Uganda, lockdown restrictions are easing out with private cars expected back on roads and shops and restaurants reopening. But everyone is encouraged to adhere to the wearing of face masks in public and physical distancing. Sri Lanka is doing the same thing, but only in the capital city. The country has lifted the daytime curfew for two of its most populated districts, Gampaha and Colombo, leading to crowds forming at markets and transport hubs. There will still be a nighttime curfew between 10 p.m. and 4 a.m. daily in all districts in the country as part of measures by the government to curb the spread of the coronavirus. Health authorities in California have announced that places of worship that were closed under one of the most restrictive coronavirus containment rules in the United States may now open. The California Department of Public Health said that businesses and churches, synagogues and mosques can reopen at 25% occupancy capacity and with other restrictions.
Take responsibility in protecting your health. The NCDC's website has all the information and stats on the cases across states with regular updates and several guidelines also as to how you can efficiently self-isolate. And from the World Health Organization, physical distancing, they've said, is one of the most effective methods to limit the spread of COVID-19. You can take a look at rolling updates on the pandemic and strategies. Each moment, it keeps you updated. Finally, our website, channelstv.com, has the latest news. All you need to do is log on, access the news in health, business, politics, sports, Africa, and around the world, all at your fingertips. www.channelstv.com. That's the COVID-19 update. Thank you for watching. I'll be back again with another update at 6 p.m. Until then, stay healthy.